Hello, and welcome to an episode of Careers in Dentistry on the Young Indian Dentist podcast series. A series that aims to provide valuable information and insights into what the exciting field of dentistry holds for us. Be prepared to boggle your mind as you are introduced to the unconventional routes that you can steer your career towards as we bring to you the best in the industry. With that, it is my absolute pleasure today to introduce our guest for the day, Dr. Praveen Rajesh, a pioneer in the field of conservative dentistry and endodontics who has been making heads turn over the past few years for not just being one of the best in his field, but also to be the first ever recipient of the MEndo degree from the Royal College of Surgeons in India. Welcome, sir. It is such a pleasure to have you with us today, and thank you so much for taking the time to be here with us. So with that, I would allow you to introduce yourself and tell us about your journey through dentistry, through conservative dentistry and endodontics, and why you chose to specialize further and get this additional training.
Well, I'm from Bangalore. I did my entire schooling, UG, everything in Bangalore. So I think we went to the same dental school as well. I did my undergraduation from 2005 to 10 at RV Dental College. And why did I take conservative? Well, I always had an inclination to do a master's in a clinical specialty, which made a significant impact in patients' life. I liked both orthodontics and endodontics equally. Both of them dealt with a lot of aesthetics and, both of them did a huge change in a patient's day-to-day life. So I really liked it. And personally, I used to like the hand skills involved in endodontics. I used to love doing fillings, RCTs and everything. So that was one reason. And a second reason was, my staff in my UG, especially Dr. Keshav and Murli, they really inspired me. They motivated me during my undergraduation. Even my ortho staff, we used to be jealous of our ortho staff because they were always so cool and happy. So for me, during my PG, my entrance exam days, I was okay with either endo or ortho. So that was my mindset from the beginning. So I got endo in a better college for my rank in KSET. So that's why I went into endo. I could have gone into endo or ortho, I don't know. But during the 3 years of my endo PG days, I realized that I took the right decision because what I envisioned and what I thought endo was totally different when I did my PG. There was so much to it. There was so much of nuances which I didn't learn in UG days. And I realized that there's so much to learn. Even after PG, I'm still learning. Even till date, I've been learning. There's so much in endo that keeps changing every day. So I'm quite happy with what I did. From there, why did I choose, to do another degree after MDS? Was that I soon realized that after MDS in endo, although I'm quite competent with most of the clinical skills, which is enough for me to open up a practice, but it didn't still give me that satisfaction that I've used my full potential that lies within me. So I kept searching for something that can bring out my potential and try to improve what I already have. That's when I came across MEndo. It was casual browsing in 2014, and after my PG, I kept searching for various fellowships or opportunities to do something abroad. And then I realized that my uncles who were doctors, they used to mention MRCS and FRCS. I used to wonder what that was. And I just browsed online and I realized that even for dentistry, we could do some Royal College fellowships. And MFDS was a very common thing that time. Many dentists have done MFDS. However, MFDS is something that we do after our undergraduation. So BDS doctors are, it's a good degree for undergraduates to do, but as a postgraduate, it's necessary that we do something in our own specialty. So I realized that there was an exam called MRD exam at that point of time. It was called the Membership in Restorative Dentistry. So I was quite fascinated with this exam, and I asked a couple of very famous endodontists in Bangalore, and I asked them, "So have you ever, given this exam, or do you know anyone who's given this exam?" They said, "Dude, I've heard of a couple of them who've given this, and they didn't clear it, and it's a very difficult exam, so don't even bother giving." I said, "Sir, but M-Morth is something that many people have given, and they have cleared. Why not MRD?" He said, "M-Morth, it's easier, man. Many people have given it and cleared it, so we know how to give. MRD is something that none of them have cleared, so I don't think you should waste your time with it." So that's the feedback I got from top-notch people from Bangalore. But this did throw me off a bit, but soon that grew into an obsession. I was like, why should that throw me off? Why don't I give it a shot? It costed around 1.5 to 2 lakhs to give this exam. So I thought it's okay, we can lose a little money, but I just want the experience of giving this exam. And in 2015, I started preparing for this exam, and I realized that my entire PG days, which I spent doing a lot of wonderful cases, was wasted because I did not document them. Okay, so it was a big issue when I realized that I don't have good completed cases with follow-ups that I could present in the Royal College. So at that time, for my MEndo exam, this exam is called the Membership in Endodontics exam, and this exam required me to give 2 restorative cases and 2 endodontic cases, and I realized that I had to, record them again right from scratch. I had to get 2 good cases. So I had to document them in under a microscope, because we needed, for endo cases, right? We need good intra-axis and intra-canal pictures. So I trained myself with microscope. I shifted my base from Bangalore to Pondicherry because I got a job offer which allowed me to record some cases under the microscope and stuff. So I changed my life quite a bit for the next 3 years, from 2015 to 18, and that helped me grow academically as well, because I learned a lot of things to prepare these cases, and did a lot of preparation. And in 2017, I gave my first attempt. I didn't clear it, and 2018, I was able to clear it. So yeah, so I think I was to elaborate on my life journey.
No.
But yeah, in 2018, I completed my MEndo, and then 2019, I quit academics, and then I opened my practice. Yeah.
Wow, that's quite an incredible journey, sir.
Thank you.
Required a lot of perseverance and a lot of focus to, you had a goal in mind and you just wanted to work towards it. That's amazing. Okay. So, if I am a postgraduate student, am I eligible to take up this exam?
Yes. In fact, if you are in your second year, you can apply for this exam. So the basic qualification for this exam is a 36-month training in your specialty, either prosto, perio, or endo. Okay. If you have completed at least 24 months of training at the day of the exam, you can give this exam. So basically, you can apply during your second year of post-graduation.
Right. Okay. That's some very interesting information, because most people think that they should have finished their post-graduation in order to be eligible to apply.
Well, I'll just tell you a brief about this exam. Sure. So, this exam is conducted by the Royal College of Surgeons. So, like the Royal College of Surgeons is a very old institute. It's around it's more than 500 years old. It started in 1500s. In Edinburgh. Edinburgh was the first center. And since then, they've been doing accreditation exams for surgeons all over the world. And one such accreditation exam was called the Membership in Restorative Dentistry. It was started, I think, in It's been there from almost 20 years now. And since 2014 or 15, they have split it into Endo, Prosto, and Perio. The MRD is split into three exams. So basically, the MRD exam split into three specialties. Um, so these exams were initially made as a endpoint exam of your specialist training. So in the UK, they have many universities. Each county has a university, and most of them don't have a exit exam. Most of them, in fact, at least in the past, they didn't have a final exam sort of thing, like how we have an RGHS or your MDS final exam, right? So instead, they used to tell their students to give the MRD exam as an exit exam. So it is designed immediately after your post graduation. So that is
Okay.
the main motto behind these examinations.
Mhm.
It's like an exit exam or like a board exam. Like in the US, how you have these. In the US, it's maybe slightly different. It's like a board exam, but in the UK, it's kind of like an exit exam. It means your training has ended. So if you pass this exam, it means your training has ended.
Right. Okay. So, as a foreign trained specialist in either endodontics, periodontics, or prosthodontics, why would I be interested in taking this exam? What opportunities would I get, or what merit would I get out of getting this degree?
All right. So this degree is from from an institute which has worldwide recognition. They have tie-ups with developed nations like Canada, Australia, Singapore, Malaysia, a lot of Asian countries, and Hong Kong, and the Middle East. Almost the entire Middle East recognizes these degrees. So, if at all you are planning to go out of India and practice, you have a tremendous advantage because they, and at least in the Middle East, in fact, you know that our current MDS doesn't hold too much of weightage nowadays. And these exams can give you a good recognition for you to be considered as a specialist. In India, if you if you look at a direct advantage, you won't find any because most institutes are run by very elder academicians, and most of them are not even out of this exam. So I wouldn't say that it would help you land a job in an academic institute. However, it builds. I mean, however, it's a huge boost to your CV in case you're applying for a research post in any good institute or any sort of or any like AIMS or something. Probably the higher academic institutes could recognize it. But apart from this, you don't have a major direct advantage in India. However, giving this exam, the process of giving this exam itself changes your clinical perspectives. It changes your clinical practice. That's what it did for me. Because you learn so much of interdisciplinary treatment planning that you wonder how come you missed so many things. Like, for example, I realized that I see more of non-carious lesions in a patient's mouth than carious lesions. Earlier on, I just used to see, okay, class 1, class 2, okay, composite, amalgam, whatever. But now I see erosion, attrition, abrasion, and how to systematically treat them, or at least how to help the patient prevent them, because those kind of lifestyle diseases are predominant nowadays based on the changed patient diet and their lifestyle, right? So we are helping patients in a bigger way, and even the way we present our cases to the patient has changed. Earlier on, it used to be you either do this treatment or you don't. Now we give them an array of treatment options, and we give them success rates and failure rates of each treatment and what are the pros and cons, and we let the patient weigh the benefits and choose their own treatment. So yeah, even our treatment planning has changed. So it helps you in your clinic practice.
Right. Okay. Thank you, sir. So, could you tell us a step-by-step approach to how to prepare to this exam? How do you apply for this exam? And just give us a brief insight into the timelines as well as the exam centers and how frequently these exams are conducted.
There are 4 Royal Colleges, and out of them, only 3 of them conduct this exam. the England, Glasgow, and Edinburgh.
Okay.
England and Glasgow conduct this exam together, and Edinburgh conducts this separately. So the England and Glasgow exam is called the bi-collegiate exam because two colleges are doing it together. Currently, they're happening online. Okay, maybe only till this year. I think from next year they'll make it offline. And Edinburgh conducts it on site. So all these exams were conducted twice a year, once in September. The Edinburgh usually happens in September and November. The September one happens in Edinburgh and UK, and in November it happens in Dubai. All right. Now, this year, 2023, they have introduced another center in Egypt at Cairo. So that's another option, but that happens in March. So that happens in the summer.
Mm-hmm.
Okay. So basically, right now, Edinburgh is conducting 3 exams, and timeline, I would say it takes about 3 months to 6 months of preparation, minimum 3 months. Okay, don't even attempt this exam without 3 months of at least 4 to 5 hours of everyday preparation. Or if you're preparing for 6 months, 2 hours a day. That should be a decent timeline. And the last 2-3 weeks, of course, you have to put in more time and prepare. It's very similar to your MDS final exam. You need to give in a lot of time because the entire endo has to be covered. In addition to endo, a little bit of prosto, perio, and other allied dental and medical science. So you should be preparing for these exams.
Right. And where do you get the study material from? Is there a syllabus that you need to study from, or what would you recommend?
Okay, the syllabus is given very clearly in the website itself. You'll have the entire blueprint of what this exam would be, encompassing. But mind you, the blueprint is vast. Basically, they write everything in endo, perio, and prosto. They expect you to learn the entire textbook and not even textbook, the entire literature. Basically, so it's very vast. The exact study material could be condensed from this based on the previous question papers, based on previous Viva questions. We have condensed this into a smaller syllabus, and we've created a reading list, which we've not published it, but we do give it to all our everyone who takes help from us in preparing for these exams.
Okay. So from what I understand, you have started an academy to train students to take these 3 exams, right? The MEndo, Prosto, and Perio. So could you tell us a little bit about your Royal Academy?
So what happened was in 2018, after I finished the exam in November, since then, like there've been a lot of people, wondering how to clear this exam because not many people have cleared it. So they kept approaching. So from 2019 to 2021, we've helped a lot of people with questions, and we've given them a lot of inputs on how to clear this exam. But what we realized was, even after we helped them, if when you do it unofficially or in a friendly manner, we don't give too much of time to these people. We just say over a phone call, they'll ask these things, focus on this. And that kind of a mentoring didn't really help them. They gave the exam and they still failed the exam. So we realized that, if we help someone, it has to be fruitful. They have to at least, have a decent shot at passing this exam. So we realized that we need to spend at least 20-25 hours with a candidate, at least, to make sure that they understand what this exam is all about, and to orient them. Because of course, theoretically everything that there is in your specialty, but this exam is very clinically or practically oriented, and they focus on nuances which we tend to miss out as a clinician, or we take for granted, especially in India, where we don't practice evidence-based dentistry in a day-to-day practice. We do cut short a lot of things. We have to do according to the existing scenario, right? It's not possible to always follow the textbook or the right guideline, but in the UK, in the exam, they expect you to do that. So We train the student how to start thinking that way. We discuss a lot of cases. We go topic wise, like right from pathophysiology of pulp uh, to endosurgeries and traumatic injuries. We discuss each topic and subtopic, and we discuss with the candidate what are the important areas in these subtopics that the examiners would ask. What are the repeated areas? So these kind of details is what helps the candidate at the end of the day. And and mock exams, you can never underestimate them. In fact, when I prepared in 2017, I had no idea how the exam would be. It was like I didn't even know what SAQs were. The SAQs were it was called short answer questions. So I knew it's supposed to be like notes, but I didn't know how to write, or what are the rules that I have to follow. So only when in my second attempt I understood all those things and I corrected my mistakes. So we do a lot of mock exams to make sure that the candidates understand what kind of an exam that they're going to go through. So mock exams and theory classes, which would be focused on a lot of case discussions and practical aspects of endodontics. So these things the candidates, and last year, 5 candidates cleared, and around 6 of them gave the exam, and out of 6 of them, 5 of them cleared. So we were quite happy with the result, because usually the pass percentage is only around 20 to 30% in these exams.
Okay. Wow.
And last year we were fortunate enough to get a lot of success. So we believe that a good training is helping these candidates do well in these exams.
Absolutely, sir. That's an incredible success story. So I would like to thank you for starting this academy and helping out so many people.
You're welcome, Maya.
Yes, sir. So coming to the day of the exam, could you tell us what the exam is like, is how many days it is, and what it constitutes?
So the exam is basically a 3-day exam. If the time doesn't permit, they usually make it a 4-day exam. It's a continuous 3-day exam. Okay, the first day would be a theory day where in the morning, probably they start around 9 a.m. in your exam center. 9 to 11 is your first paper. It's a 2-hour paper. You'll have 10 questions in them. Each question will have around 5 to 6 sub-questions. So they're all case-based scenarios. There'll be like a 35-year-old man came with pain on your right side, and there'll be a lot of sub-questions based on it. And they would, so earlier on they had a respirator paper and an endo paper, but right now both the papers are endo. So one in the morning and one in the afternoon. So between 9 to 11, and I think the second paper would be between 1 to 3 p.m. So that's day 1. Day 2 would be, they're all unseen cases. Unseen cases mean some station where you'll be given records of a patient. You'll be given a little bit of time to go through these records, and then you need to go and sit for the viva. Okay? So this entire process for one case takes about half an hour. So 15 minutes for examination and 15 minutes for viva. So this happens 4 times during the day. So these are called long cases. Okay. So maybe 2 in the morning and 2 in the afternoon or evening. So that's how your second day would go. Third day would be short cases. This is like something like a spotters. They'll show you some case records and they'll immediately expect you to answer some questions based on it. So it'll be like a rapid fire spotter kind of a scenario. So in the morning they would discuss 4 cases, and in the evening they would discuss 4 cases. So totally 8 cases, right? So that's the exam. So if you clear the theory separately and your unseen cases separately, you pass the exam. If you fail your theory and you clear the unseen cases, even then you have to give the entire exam again. But if you clear your theory and if you fail your unseen cases, the pass in the theory carries over to the next attempt, and you can just give your unseen cases again.
Okay, all right. So, and you also mentioned that the Royal College of Surgeons of England and Ireland, if I'm not wrong, are conducting the online exam. How different is that from the one that's conducted by Edinburgh?
So England and Glasgow, they
Glasgow,
conducted
sorry.
together. They're till last year I checked that they were doing it online because of the COVID scenario and with the travel restriction there were a lot of problems. So this year I believe they'll be making it physical again. So how different are these exams? Well, uh, the main difference is one in their approachability. The Edinburgh people are more receptive to international candidates. The England and Glasgow people somewhat are a little difficult to approach over mail. They take longer time to respond and stuff. And the exam pattern is slightly different. You have little longer papers, little longer Viva sessions, and their Viva sessions are more interdisciplinary in nature. So basically, they expect you to have, even if you're an endodontist, they expect you to have more knowledge on prosto and perio as well. So, which could be difficult as being an endodontist. So, of course, if you're confident, if you have that level of training with prosto and perio, you can give that as well. But I would recommend giving the Edinburgh exam because they're more specialist conscious and they're at 80 to 90% of their exam is endo based. So in contrast to the England exam where almost only 60 to 70% would be endo based, 30 to 40% of the exam would be interdisciplinary. So you got to be aware of this. And we believe that a lot of international candidates, especially Indians, have given the Edinburgh exam, and most of our students have given the Edinburgh exam. So we have a good question bank. We know what questions of course, not all the questions. We at least have a pretty rough idea, a pretty good idea of what's going to come in these exams, in the Edinburgh exams. Yeah. So I would recommend you to give the Edinburgh exam.
Okay. And when do you typically get to know the results and how you've done?
I think 6 to 8 weeks from the date of the exam.
Okay. Right. Okay, sir. And once you clear this exam and you're awarded a diplomate from the Royal College of Surgeons of Edinburgh or whichever college you go to, does that give you the license to practice in, let's say, UK?
It doesn't give you a direct license. However, once you clear your ORE, you will be considered as an equal to a specialist in the UK. You can apply to be registered in the specialist list in your deanery, and after that you can practice as a specialist. So basically, you need to still give your ORE to be able to practice in the UK. But the advantage is, even after an MDS in India, if you give an ORE, you're still a general dentist in the UK.
Okay.
So with MEndo, you become a specialist.
Right. Yeah. That makes sense. Every country has their own qualifying exam, which you have to clear in order to be licensed to practice in that country.
Right.
Okay. Yes, sir. So speaking of your academy, would you like to talk about when your next course is and how long your course is?
Oh, well, our next batch starts in 10 days.
Okay.
Feb 17th, we are starting the next batch. So this is MEndo. And we've recently come out with the M Prosto and Perio as well. M Prosto, we are starting on March mid, we'll be starting this year. And M Perio will be starting sometime in April. So all of these these courses are 3-month training programs, which will last, so from Feb 17 to May end would be the typical training program. And it happens on Fridays and Saturdays, usually the weekends in the Middle East, because most of our students are from the Middle East. It usually happens either in the morning or afternoon, depends on what the students want. They're all live sessions. We have mentors from abroad, from Kuwait and Saudi and Egypt. All of them come and contribute for the classes. I'll be taking a majority of the endo portions, prosto from an M prosto expert, perio from an M perio expert, biostatistic from a biostatistic expert. We have general medicine and general dentistry classes as well. So it's a culmination of a lot of faculty, and we'll be having a lot of theory mock papers in between these sessions. And at the end of the program, we'll be having a complete grand viva or a mock to ensure that you understood the exam process. So we've been doing this from 2021 beginning. So this is our third batch right now.
That's really nice, sir. Is there any message that you have to aspirants who are preparing for these 3 exams?
Oh, well, the biggest message that I can give is give everything you have to these exams. Give your 100%, and don't be afraid of failure. So right from, especially for gold medalists in there, I was always an average student. So I was okay with failing sometimes. But I've seen the gold medalists are so afraid of failing, and the toppers are so afraid that they really don't want to give this exam because they're scared they'll fail. So I would say just go and give this exam. Of course, there's a little bit of training that's needed. Do it and give the exam. Don't be afraid. Don't be afraid of failure. Even if you fail, you can always give this exam again. So be persistent. That's probably, this advice holds good for anything in life, but especially for this exam. Okay, be persistent. That's the key to success in this exam.
All right. Thank you so much, sir, for that inspiring conversation that we just had, and for showing us that perseverance and hard work is the only thing that will help you achieve your goal, no matter how hard the path of success is. I hope you enjoyed. Yes. I hope you enjoyed that intriguing conversation with Dr. Praveen Rajesh, sir. So it's been such a pleasure to have you on this podcast with us. You've left us curious and inspired to take on this unconventional and exciting route. If you found this video useful, do subscribe to our YouTube channel and follow us on Instagram at The Young Indian Dentist, the links for which will be provided in the description below. We will also be providing links to Dr. Praveen Sir's academy and his course dates in the description. This is Dr. Megha Rao signing off and welcoming you to come join the network.